The human brain is a marvel of complexity and sophistication, governing our thoughts, movements, and emotions. This remarkable organ is also vulnerable to various health challenges, one of the most critical being a stroke. A stroke occurs when the blood supply to the brain is interrupted or reduced, resulting in damage to brain cells and potentially life-altering consequences. While strokes can strike suddenly and with little warning, there are often subtle signals that can emerge in the weeks leading up to this life-threatening event. Recognizing these warning signs of a stroke 1 month before it occurs can be crucial in preventing or mitigating its devastating impact. In this video, we will explore the subtle but significant indicators that may herald an impending stroke, empowering you to take timely action to protect your health. So let's get started and talk about the 7 warning signs of stroke 1 month before. Number 1. Vision changes. Alterations in one's vision can manifest in various ways, including blurriness, double vision, peripheral vision loss, or the perception of flashes of light. While certain changes in vision may be benign and associated with temporary factors such as fatigue or eye strain, they can also serve as warning signs for underlying health concerns that require immediate attention. Among the most concerning conditions associated with alterations in vision is retinal detachment, a medical emergency in which the retina becomes dislodged from its normal position, potentially causing permanent vision loss if not promptly treated. Sudden changes in vision can also serve as an early indicator of a migraine or an impending migraine attack, often accompanied by auras such as flashing lights or zigzag lines. Gradual changes in vision might indicate eye diseases like glaucoma or age-related macular degeneration, both of which can lead to vision impairment or even blindness if left untreated. Changes in vision may also be linked to systemic health issues like diabetes, which can affect the blood vessels in the eyes and result in diabetic retinopathy. Number 2. Numbness or weakness. Sudden and unexplained numbness or weakness can serve as a potential indicator of a neurological event, such as a stroke. During a stroke, impaired blood flow to the brain can result in temporary or permanent numbness or weakness in specific areas of the body. It's crucial to understand that strokes are medical emergencies necessitating immediate attention and medical intervention to minimize potential brain damage and maximize the chances of recovery. Numbness or weakness may stem from nerve compression, often observed in conditions like herniated discs in the spine, carpal tunnel syndrome, or sciatica. These conditions can lead to discomfort, a decrease in mobility, or impaired fine motor skills. Numbness or weakness might be associated with systemic conditions such as multiple sclerosis, in which the immune system attacks the protective covering of nerve fibers, giving rise to a diverse range of neurological symptoms. Diabetes can also contribute to nerve damage, a condition known as diabetic neuropathy, which predominantly manifests as numbness or weakness in the extremities. Numbness and weakness can also manifest as symptoms of less severe conditions like pinched nerves, muscle strains, or overexertion, typically resolving with adequate rest and time. Number 3. Trouble speaking. Difficulty in speaking serves as a crucial warning sign for impending health concerns, particularly when it manifests as slurred speech, disjointed articulation, or the inability to find appropriate words. Such speech challenges can signify various underlying conditions, one of which is a stroke. In cases of stroke, impaired communication can occur due to brain damage or disruptions in blood flow. These difficulties in speech may stem from harm to language centers within the brain, such as Broca's or Wernicke's area, with the severity varying based on the extent of brain injury. It's important to note that trouble speaking is not limited to strokes. It can also be associated with other neurological disorders like multiple sclerosis or brain tumors, as well as non-neurological causes such as side effects from medications, intoxication, or extreme fatigue. In some instances, speech issues can act as an early warning sign of a transient ischemic attack, or TIA, often referred to as a mini-stroke, necessitating immediate medical attention as it may foreshadow a full-blown stroke. Speech difficulties may also arise from conditions unrelated to the nervous system, including vocal cord problems or specific infections. Number 4. Confusion. Confusion is a mental state marked by a sense of disorientation and mental bewilderment, often leading to a lack of clarity and logical thinking. It can have various triggers, including medical conditions, stress fatigue, or substance abuse. People experiencing confusion may encounter difficulties concentrating on tasks, making decisions, or retaining important information. The presence of confusion can be particularly worrisome when it arises suddenly or persists for an extended duration. Acute confusion, also known as delirium, represents a critical medical condition that can result from underlying factors such as infections, medication side effects, or metabolic imbalances. Delirium is characterized by a rapid onset of confusion, alterations in consciousness, and fluctuating cognitive function. As a medical emergency, it necessitates immediate assessment and treatment. Chronic confusion may be linked to conditions such as dementia or Alzheimer's disease, where gradual cognitive decline impairs memory, reasoning, and problem-solving abilities over time. Number 5. Trouble swallowing. Dysphagia, commonly known as difficulty swallowing, is a complex medical condition marked by an impaired ability to move food or liquids from the mouth to the stomach. It can arise from various factors spanning from mild to severe and potentially pose life-threatening risks. This distressing symptom may stem from neurological issues such as strokes, Parkinson's disease, or multiple sclerosis, disrupting the intricate coordination needed for swallowing. Muscle dysfunction, as observed in conditions like myasthenia gravis or muscular dystrophy, can also result in swallowing difficulties. Structural issues like esophageal narrowing due to tumors, strictures, or gastroesophageal reflux disease, or GERD, can contribute to dysphagia. The natural aging process itself can decrease swallowing efficiency. It is crucial to identify the underlying cause of difficulty swallowing, as it can range from minor discomfort to serious conditions like aspiration pneumonia or malnutrition if left untreated. Diagnostic methods such as barium swallow tests, endoscopies, or nerve conduction studies aid healthcare providers in pinpointing the root cause and determining appropriate treatment strategies. Number 6. Face drooping. Facial drooping typically presents as an asymmetrical and lopsided appearance on one side of the face. The affected facial muscles may lose their tone, resulting in noticeable drooping of the eyelid and the corner of the mouth. This drooping can also lead to difficulties in closing the eye or maintaining a balanced facial expression. The root cause of this facial asymmetry is the disruption of blood flow to the facial nerves, particularly the 7th cranial nerve, also known as the facial nerve. This nerve is responsible for controlling various facial functions, including the muscles that govern facial expressions and movements. In the event of a stroke, the blood supply to this nerve is compromised, leading to the weakening or paralysis of the facial muscles on one side. Beyond its immediate visual impact, facial drooping can impair essential functions like eating, drinking, and speaking, underscoring the importance of prompt recognition and response. To assess facial drooping as a potential indicator of a stroke, healthcare professionals often advise patients to smile. An individual experiencing facial drooping will struggle to maintain a symmetrical smile, as the unaffected side of the face responds normally while the affected side remains slack. Number 7. Leg weakness. Leg weakness typically presents as a reduced ability to move one or both legs, often accompanied by sensations of heaviness, numbness, or tingling. One prevalent cause of leg weakness is nerve compression or damage, as seen in conditions like sciatica, where pressure on the sciatic nerve leads to discomfort and leg weakness. Disorders affecting the spinal cord, such as multiple sclerosis or spinal stenosis, can also result in leg weakness, as signals from the brain struggle to reach the legs effectively. Certain systemic illnesses, including diabetes, can lead to peripheral neuropathy, causing muscle weakness and numbness in the legs. Leg weakness may serve as a critical warning sign of a stroke or transient ischemic attack, or TIA, particularly if it suddenly appears alongside other stroke-related symptoms such as facial drooping, difficulty speaking, or vision changes. Leg weakness can also arise from non-neurological causes like electrolyte imbalances, muscle disorders, or vascular problems. When leg weakness persists, it can significantly affect an individual's mobility and quality of life, emphasizing the importance of seeking prompt medical evaluation and diagnosis. We hope you have found this information valuable and insightful. Remember, early recognition of these warning signs can be crucial in preventing a stroke. However, it's essential to consult with a healthcare professional for a proper diagnosis and personalized advice. Please note that the content in this video is for informational purposes only and should not replace professional medical advice. If you or someone you know is experiencing any of the symptoms discussed, seek immediate medical attention. Don't forget to like, subscribe, and share this video to help others stay informed about their health.